Posterior periapicals using paralleling technique. In this video, we will demonstrate how to take posterior periapicals using the paralleling technique. In the posterior region, size 2 receptor is used and is always placed with the long portion of the receptor sideways. When placing the biblock on the receptor, make sure that the flat side, blue side of the receptor is facing the PID and it's on the middle of the ring in order to avoid cone cuts and to expose the right area. A total of 8 posterior images are exposed, 4 maxillary exposures and 4 mandibular exposures. It's important to note that the same configuration used for the upper right will be used for lower left, and the same configuration used for the upper left will be used for the lower right. When exposing posterior periapicals on a patient or dexter, begin with the maxillary right molar exposure. But in this video, we will demonstrate the maxillary left molar exposure first. Position the receptor at the center of second maxillary molar and far away from the teeth, meaning the receptor should be placed towards the middle of the palate. Once the receptor has been positioned, ask the patient to bite down slowly on the bite block. Align the tube head with the ring and make sure that the primary beam is directed perpendicular to the receptor and the PID should face downward. Expose the receptor. This exposure should include all crowns and roots of all present molars on that maxillary area and the distal contact of the maxillary second premolars. That would include the apices of the teeth, contact areas, as well as 2 millimeters below the apices in order to include their surrounding structures. Once the maxillary molar exposure of one side has been completed, move to the maxillary premolar exposure of the same side. Center the receptor at the center of the teeth that you are aiming to expose. In this case, at the center of the first maxillary premolar. For this image, we want to include the crowns and apices of both maxillary premolars, including the distal aspect of the canine and the mesial aspect of the first molar. Of course, 2 millimeters below the apices in order to include their surrounding structures. Make sure the receptor is placed towards the middle of the palate in order to achieve parallelism with the long axis of the tooth. Then align the PID with the ring and expose the receptor. After completing the maxillary premolar exposure of one side, move to the mandibular exposures of the opposite side. In this case, we will continue with the mandibular right molar exposure first. Center the receptor at the mandibular second molar. Position the receptor away from the teeth and towards the middle of the tongue or the floor of the mouth. Instruct the patient to bite down slowly and align the PID with the ring, always making sure that the primary beam is placed perpendicular to the receptor and that the receptor is placed parallel to the teeth. Then expose the receptor. In this image, we want to include crowns and apices of all present mandibular molars in this area, as well as the distal aspect of the second premolar of that side and 2 millimeters below the apices in order to include their surrounding structures. The same steps must be used for the mandibular premolar exposures. Center the receptor at the first mandibular premolar and away from the teeth. Have the patient bite down on a bite block and align the PID with the ring. Notice for the mandibular exposures the PID is facing slightly upward. Expose the receptor. This image should include all crowns and apices of the present premolars, the distal aspect of the mandibular canine, and the medial aspect of the mandibular first molar, as well as 2 millimeters below the apices to include their surrounding structures. Then reassemble the ring for the opposite side. The same steps must be repeated. Begin with the molar exposure by placing the receptor at the center of second molar. Have the patient bite down and align the PID with the ring. Then expose the receptor. For the premolar exposure, move the receptor slightly to the front by placing it at the middle of the first maxillary premolar. Align the PID and expose the receptor. Then move to the opposite side of the mandibular arch. For the molar exposure, place the receptor by the second mandibular molar of that side. Instruct the patient to bite down and align the PID with the ring. Lastly, expose the receptor. For the premolar exposure, move the receptor slightly towards the front and the center of the first premolar, away from the teeth. Instruct the patient to bite down, align the PID with the receptor, and expose the receptor.